Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Bostix Titus issue. This audio podcast is part of an analytical storm and a science storm. An audio podcast is part of a Storm of the Bostix production. In this audio podcast, there will be an overview in around the methodology aspects of in around in around in around as part of this audio podcast series in regards to a draft peer reviewed works, and so thus the research the research team the research team as co-developed a tagging activity wherein topics between two social media platforms were co-developed or created, having understood aims and remit of the social media platforms. Tags were then co-developed against 14 different topics, having extensively investigated over and during a 1 month during a 1 month time span between March 2020 and April 2020. In uh, um, March 2020 and April 2020, the most popular terminologies in context of terminologies used between the social media platform social media between the two social media platforms. The topics were tagged for 2 weeks per social media platform, um, for 2 weeks per social media platform, i.e., 2 weeks between one social media platform representing an adult healthcare specialty, and 2 weeks through a social media platform representing a pediatrics and young people's healthcare specialty. um, and topics were tagged retrospectively, to understand to help understand what areas of healthcare are popular, and where patients between the two social media platforms would find it advantageous to have healthcare professional involvement in regard to further further support in context of healthcare, and descriptive as part of the works. The descriptive analysis would be used to analyze data. In addition, conducting or carrying out a 10-year a 10-year and 6-year retrospective descriptive analysis of topics and tags between the social media platforms, representing pediatrics and young people's population, and uh, an adult sort of healthcare population, um, um, would help to understand where there are healthcare healthcare educational inefficiencies, and also to clarify and identify what information needs still need to be met in context of care for both online uh, online platforms. And so, in into the tagging, co-development and implementation aspect. So before topic tagging implementation, a piloting sorry before a topic tagging implementation and piloting, the chief admins and moderators between the social media platforms before this between the social um, uh, um, between the social media platforms, highlighted an understanding of um, how members generally use the social media platforms for sharing experiences and understanding at different in around different aspects of the disease, in around health and disease trajectory. The topics were tagged with topic tags were then co-developed, wherein a research intern worked with the founders to understand what areas of health and care uh, um, health and care are popular, using a facility on using a sort of a coding facility, if you like, on the social media platform, in between the two social media platforms. The teams organized a co-production meeting, wherein it was discussed and decided that, given that both social media platforms have an international membership and global reach, it would be advantageous to ensure that topics and tags gain a maximum number of tag topics between the two social media platforms. And this were aimed thus to further tag as many topics according to designated themes over a 1 month duration between the two social media platforms. And this was limited. It was limited to 1 month. It was limited to 1 month, 1 month, a 1 month duration. And at the same time, a sample size calculation was not carried out. Was not carried out. And in the in As part of this, in context of the ethics aspects, the ethical aspects, all members between the two social media platforms were informed to refer to um, sorry all members between the two social media platforms were informed to refer to group disclaimers, the social media platform disclaimers, and that topics would be tagged for a 1 month for 2 weeks on one social media platform, and 2 weeks on the second social media platform. And the admin and moderating teams between the pediatrics and young people's social media platform and the adult social media platform in context of in context of healthcare. So in context of healthcare were um, uh, uh, had also pinned an a sort of a feature at the top of the social media platform, so that members would know, number one, that this was to help identify sort of lived experiences, or experiences relating to themes and subject entities. Number two, to highlight how tagging activity is being conducted to identify discussions relevant to health focuses and scenarios more swiftly. And three, overall highlight how two social media platforms how the two social media platforms help in searching out information to ongoing aspects surrounding healthcare. At the t- and so uh, Second part to the sort of ethical principles, if you like, was that as part of the work, members between both social media platforms were also informed that tagging or to, topics and taggings and tagging were would would remain a confidential and within the remit or within the remit of the social media platforms. Group disclaimers also encouraged and informed consent. Consideration for the need for ethics for ethics approval in context of a more in-depth documentation was made, and thus a Department of Health guidance was consulted, and at the time the governance arrangements for research ethics committee document from 2012 was referred to. Ethics committee committee approval was not formally required for the work. However, guidelines in around the General Data Protection Regulation, or GDPR 2018, were followed, and in around the General Data Protection Regulation, a sort of a revisit a sort of a revisiting um, um, uh, revisiting of the GDPR 2018 includes as thus. So primarily the two social media platforms are both closed social media groups or platforms, and for patients and carers, amongst others, suffering with particular forms of kidney disease. And the social media platforms are covered primarily under are covered in context of social as a social media platform or entity, generally under under Facebook's data privacy and protection policy. The GDPR creates a consistent data protection rules across the EU, and the GDPR had been in effect as of the 25th of May 2018, and applies to organizations based in the EU, as well as to companies or organizations around the world who, who provide or offer goods or services, and who process data from or about people in the EU. And so, in keeping with GDPR 2018, the research team the team have had not reported any personal identifiable data, or PID, such as, for example, names, dates of birth, addresses, and or locations of patients, of any participants. The GDPR 2018 and data protection guidelines were adhered to and applied throughout accordingly. So that draws this audio podcast to a close in around this in around this in this overview, as part of in this overview, and this being another audio podcast as part of the Bostix Titus issue, an audio podcast as part of an analytical storm, and an audio podcast as part of a SZtorm, and as part of another Storm Bostix production.